This is a presentation about muscle compartments of the arm. We'll start off with a concept review, discuss the boundaries, and then using an anatomical model of the upper limb, identify the location of arm compartments, discuss some common features, and use relevant principles to help complete set activities. So take a moment now to remind yourself of what a muscle compartment is, and you've very likely come across them already in your studies of the lower limb. So jot down your thoughts about muscle compartments. Some of the principles that we'll use today, M15 and M16. M15 says muscles of a common function at a joint are usually located together in a muscle compartment, innervated by the same nerve, and share the same common arterial supply and venous and lymphatic drainage. And also muscle compartments of a limb may be bounded by bone and or deep fascia. So hopefully as you were reviewing or thinking about what you remembered about muscle compartments, terms like common function, common nerve and blood supply were coming into your mind. So function in a muscle compartment is localized to a particular region, it acts on a similar joint, and there's also a benefit of helping to limit infection spread. This is a diagram taken from your manual, and let's take a moment to understand what we're looking at. It's a cross-section of the arm. This is the anterior aspect and the posterior aspect, and we can see in cross-section the shaft of the humerus itself. The green shading represents the anterior arm compartment. And you can see, tracing around here, the boundaries of the muscle compartment are deep fascia and also part of the humerus itself. So within this compartment, muscles will have a common function and will have a common innervation and blood supply and drainage. Moving posteriorly, we can see the red shaded tissue is the posterior arm compartment in cross-section, and again it's partly bounded by the humerus and by deep fascia. Thickenings of deep fascia are termed the medial intermuscular septum and the lateral intermuscular septum, and these are very thick sheets of deep fascia that help bound the muscle compartment itself. So now let's look at a model of the upper limb to identify the location of the anterior and posterior muscle compartments. On this model of the right upper limb, we're looking at a medial view of the arm. So to orientate yourself, here's the posteriorly located scapula and the anteriorly located clavicle, and this is a medial view of the right arm components. So the anterior components, muscles, include the biceps brachii, we can see the two heads here, the coracobrachialis. The third muscle, the brachialis, is mostly obscured in this view. We can see a small segment here, and we'll see the rest of it on a lateral view of the upper limb. We're now on the lateral view of the right upper limb, and to orientate yourself, here's the anterior pec major and the posterior teres major, and we can see more clearly the brachialis muscle that we couldn't fully see on our earlier view. So it's located here, and just anterior to that is the bulky biceps, which was obscuring it on our previous view. So to move to the posterior compartment, we can identify the large triceps muscle as a whole. Here's the long head, the lateral head, and if we remove the lateral head, we'll more clearly see the medial head of triceps here. And then the much smaller and inferiorly located anconeus muscle. Now that you've seen the location on the model, two more principles that we will need for completing some activities are principles M20 and M21. Principle M20 tells us that muscles producing extension, abduction or external rotation at a joint in the limb will be innervated by nerves derived from the posterior divisions of the anterior primary rami of a nerve plexus. And principle M21 tells us muscles producing flexion, adduction or internal rotation at joints in the limb will be innervated by nerves derived from the anterior divisions of anterior primary rami in a nerve plexus. So there's a pattern of innervation that's important for you to remember. So we've already discussed that muscle compartments share some features in common in terms of nerve supply, muscle actions, blood supply, etc. Here's the same image of the arm compartments. This is the anterior aspect, so here is our anterior arm compartment. Posterior aspect, so here is our posterior arm compartment. Again, it's a cross-section diagram from your student manual. And as an activity, we will discuss the common features of the anterior muscle compartment, and then I'll ask you to complete the same questions for the posterior muscle compartment in your own time. So, action of the muscles. These muscles are located anterior to the elbow joint and will produce an anteriorly directed movement termed flexion. The innervation will be the musculocutaneous nerve, and it will be the anterior divisions of the nerve plexus, and the blood supply will be the brachial artery, shown here in cross section. So all of the muscles in the anterior compartment will share the same action, innervation and blood supply. So pause the video now and take the time to complete the same information for the posterior muscle compartment, which is directed as an activity for you here. You can check your answers on the relevant forum and post any questions on the relevant forum.